Okay, we're going to get started. Welcome everyone to the information session about the PhD program in public health at Georgia State University. My name is Christine Stauber, and I'm joined by Dr. Amanda Gilmore.
Hi, everyone.
And we'll be taking turns sharing a little bit about the program with you today, and then there'll be an opportunity for questions. Okay? All right, let me get started. So I just introduced us, sorry. We are in different departments. I'm in the Department of Population Health Sciences, which houses two of our PhD concentration. And Dr. Gilmore is in the Department of Health Policy and Behavioral Sciences. And we'll share a little bit more about these departments in a minute. I think maybe we're going to just tell you a little bit about why you should be interested in applying to the Georgia State University School of Public Health. We'll give you a little bit of background about the PhD program in public health, and then ultimately we'll talk a lot about the application process. So Amanda, do you want to share with our attendees why they should come to the Georgia State University School of Public Health?
Sure, I'd be more than happy to. So I'm sure you're aware of this already. Atlanta is the public health capital of the United States. We have the CDC here, but we also have a lot of other really exciting organizations around. And so if you're wanting to get into public health, this is the place to be. We also have a lot of community partnerships and a lot of really exciting research going on. So I actually moved here 4 years ago and have been so impressed with the School of Public Health. And we are really, our faculty are doing incredible work here. And it's just a really exciting place to be. Our faculty are also really kind, which is important when looking for graduate programs. They're approachable, really easy to talk to and to learn from, and they have so much to share in terms of their research knowledge. They are incredibly productive. We, I think it was that we brought in $17 million in terms of research dollars just in our school alone this past year. So we are doing a lot of important research, and we are very committed to the learning of our PhD students. We're also really committed to building a culture of justice, equity, diversity, and inclusion in our curriculum, in our research, and our mentoring. We really go to a lot of trainings to ensure that we are doing this well. And that is something that our School of Public Health is really committed to. All of the faculty are committed to that mission. So it's a great place to be. And some quick facts, as you can see here, we have a majority minority students. We have a lot of Fulbright students. Georgia State is listed as the #2 most innovative university because we have a lot of really lovely programs that are focused on student success. And CDC is our top employer for our alumni. So if you're, since we're right next door to CDC, it is a really nice partnership that we have.
Great, thank you. I'll just give a little bit of background. Amanda mentioned that she came to the school 4 years ago. I came to Georgia State in 2008. So right in between where this program was initiating and where we launched the PhD program. So I've been here since the beginning of our PhD program, which was launched in 2011. In 2012, Dean Michael Erickson was named the founding dean of the Institute of Public Health. And in 2013, we became an accredited School of Public Health through the Council on Education for Public Health. And this year, we're celebrating our 10th year as a school. There's lots of fun, exciting events that we're doing to support this important anniversary for us. Just a couple details about the program itself. It is 62 credit hours, and the focus is on advancing health through leadership, scholarship, research, and service to better the human condition and promote the common good. Our focus for the PhD program is really around training in designing research, conducting research studies, analyzing data, and disseminating results, all with an emphasis on understanding health disparities and employing public health research and practice to reduce them. And this is focused on throughout our curriculum and our research, and also as we go on into practice. We have admitted our first PhD cohort in 2011, and this will be our 14th cohort, fall of 2024. There are more than 75 students that have graduated with their PhD from our program to date. And why I say plus is because they're completing their degrees all the time. So we have a number of students who are doing dissertation defense this semester. To add to that number, our students go into a variety of programs after their degree. Some will go on to the Epidemic Intelligence Service, which is a fellowship at the Centers for Disease Control and Prevention. Others go into research positions in academic settings. Some will initially start out in a postdoctoral fellowship, and many are in research positions in government. They have a wide range of educational and professional experiences when they come to our program. Not all have a master's of public health. Some may come with other master's degrees, and they all become trained in public health in the program. The program was designed to be a 4-year program for full-time students, but approximately a third of our students work full-time and may go to school what is considered part-time, which often is still as many credit hours as our full-time students. Those students that are working full-time and going to school part-time may take a little bit longer to complete the degree, depending on how flexible their work experience, their work setting is. So Amanda, would you want to talk about this aspect?
Yeah, of course. So each student is assigned to a faculty advisor, and that's really someone that you apply to work with. So we'll talk through this a little bit more, but you'll have a faculty advisor that you work with, and they are really meant to be matched based on your research interests, because this would be the person that would be your dissertation chair. They're really going to be guiding you through the program, and you're going to be working really closely with them. And so typically our faculty, if they have a fellowship available, that's also tied to a faculty member. So you really would be working with them for your fellowship and throughout the program. And you're not only going to just be working with that one faculty member, you're going to be establishing relationships with several faculty members, because ultimately you'll have a dissertation committee. I know that's hard to think about right now when you're thinking of your application, but eventually you'll be proposing and defending your dissertation, and that's usually you'll want to have 2 or 3 faculty members involved in that. So you get to know a lot of faculty along the way. And we are committed to offering assistantships and fellowships to our full-time students. Those fellowships and assistantships come with a stipend and a tuition waiver. And the expectation is that you'd be working in that fellowship. It should be pretty directly tied to what you're interested in learning too, because remember, you'd be tied with your research mentor and your faculty advisor. So you'd be working on things, hands-on learning, but you'd also get paid for that, which is really nice. So that comes with a stipend and tuition waiver for 20 hours a week of work and you do that on top of your course load. And we have 4 concentrations in the PhD program. So as Dr. Stauber was mentioning, in population health sciences, there are 2 concentrations, epidemiology and environmental health. And then we also have in health policy and behavioral sciences, that's the department that I'm the PhD director of. We have health services and policy research and health promotion and behavior research. And you might, as you're looking through which concentration you're interested in on the website, and also which faculty you're interested in, those do not have to match. It does need to be someone in the School of Public Health, but let's say you're interested in working with someone who is a health promotion and behavior research faculty member, but you want to do epidemiology as your concentration, that is okay. Just wanted to give you a heads up about that because I know that can be confusing. But we do have these separate concentrations, and everyone takes the core courses, but there are separate concentration classes. So that way you get a really deep learning experience within that concentration. So the core courses that everyone takes. So sometimes, do we have this later about needing a master's degree to apply? Okay, so if you come in with a MPH master's degree, then you would just jump right into the core courses. So everyone takes these courses, which is nice because everyone in this PhD program is getting these classes together. You get to meet your cohort and spend time with them and learn with them. And no matter what the concentration is. So there's course in epidemiology, in theory and practice, in terms of health and prevention, advanced research methods, where you learn to write a research grant, and obviously lots of other research methods, public health ethics. And we have a really strong biostatistics set of courses. So biostats 1 and 2 really set you up well to be able to do the statistics you need. And then there's some more advanced courses as well.
And I do see a couple of notes in the chat and Q&A, and we will definitely get to those when we finish this fairly brief presentation.
We also have a doctoral practicum, which is a teaching assistantship. So you'd be doing a teaching assistantship with a faculty member. This would really help you as if you're preparing or even considering working in academia. But if not, it really does give you a deep learning experience to really understand the course content. Some people do that with MPH classes, doctoral classes, and even bachelor's classes. And then you also will be obviously doing a doctoral dissertation. And so you need 9 credit hours for that. We have a doctoral professional and research seminar, which is a 2-course series that all students take as well. And it's a really nice class where you go through and really get a lot of professional training and helps prepare you for a career in public health research. Go ahead.
Some other requirements also are an annual review of your progress in the program. We will ask you to meet with your primary advisor to go over progress on different coursework, progress on other components of the program, such as your required activities like the teaching practicum, which we mentioned as the doctoral practicum, or the comprehensive assessment process. You have a program of study to complete that's comprised of, as Dr. Gilmore mentioned, the core courses as well as elective and concentration courses. So the core courses and the other requirements that everyone does is approximately 25 credit hours. The rest of the credit hours come from your concentration activities. There is a comprehensive assessment process, which takes place to determine if you're ready to move on to the research phase of your work, to move into the dissertation activities, and then ultimately your dissertation. And most of that is guided by faculty mentoring, most of the latter parts of the process. Did you want to add anything? Great. These are the nuts and bolts of what has to happen. To apply to the PhD program at Georgia State University School of Public Health, you have to submit an application through SOFIS, and there is a $145 fee, although some people may be able to get that fee waived. And there is a separate application through Georgia State University supplemental application process, which is the GSU CAS liaison. There is a $50 fee for that. So there's 2 fees, and both of these have to be completed with all the materials required by December 1st. We'll go over this, but there are some great resources on our website about how to apply, what there are frequently asked questions. But as we mentioned, it's key for you to be familiar with who our faculty are, the research that they're doing. And we think that your application is likely to be more successful if you are directing your approach and your research interests to faculty that are currently accepting PhD students, because those are faculty that are guaranteed to have fellowships to support students in most cases. And what we'll do is we'll share some helpful hints for the application process, and we'll also go to our main website so you can see these resources. So as we mentioned, you're really applying to work with a faculty member and their research program, and it's key that that comes through both in your statement of purpose and objectives for why you want to get a PhD, as well as in your communication about the topic area that you're interested in. It's important that you have letters of recommendation that speak to your preparedness to take on an academic degree like a PhD and why you're ready for this stage, as well as experience you might have. Ideally, you would have at least a faculty member in another academic program provide a letter of recommendation for you. But if that's not possible because it's been a long time, you might think about others that can attest to your ability to take on the sort of academic rigor of a PhD program. And as I said before, and we've mentioned many times, it's key to identify faculty members and align your application to their interests. And even reaching out to them prior is a good tool because they may be able to shed some light on what they're working on. The applications are due in the beginning of December, but certainly it can take time to get a lot of the materials into the system. So you really want to make sure that you're not waiting till the very last minute. And then there are other scholarship opportunities aside from the individual faculty member fellowships that you can identify through these links here, such as graduate school has a link for different types of fellowships. And there are other scholarship programs that allow doctoral scholars to apply and go to other programs, like the SREB scholarships. Do you want to add anything?
No, I think you have it covered.
Okay, so I think this is the end of our informational presentation, but I will stop sharing the slides and go to our website so you can see that, and then we'll be happy to answer questions. This is our contact information. If you reach out to me and you have a question that I think is better answered by Dr. Gilmore, I'll easily share that information with her and vice versa. So if you get it wrong because you reach out to someone that's in a different concentration, there's not a problem. If you have general questions about your application, it's better to reach out to SPH admissions because we don't manage the main components of those applications as much. We're mostly here on guidance about how to apply and how to frame your application. Okay, so I'm going to stop sharing my screen, and I will just open up the main website so you can see.
I can share it if you want,
Okay.
or do you already have it up?
Yeah,
but you've got it up.
Yeah, so a couple of things to share with you. If you go to the Doctor of Philosophy page, admissions program talks about our program, the curriculum, the application process, and it highlights different faculty. And as I shared, there is a group of faculty members that are, currently recruiting, a robust group of faculty members that if you click on their picture, you can learn about their research areas and the work that they do. Some have also provided a question and answer for potential PhD students. And so you can see we have a good number of faculty members that are recruiting for the fall semester 2024. Okay. I will now stop talking. Dr. Gilmore, do you want to add anything else?
Yeah, I'll just say that I know that you mentioned that you can reach out to the faculty members that are accepting students. I would just recommend first looking at their website and looking at the Q&A, if they have a Q&A up on there, just so that way you're not asking questions that they already have answered for you. And then you can obviously reach out and ask with more questions or just to introduce yourself. That would be fine. But just make sure to do your homework first before reaching out, because that does sometimes show to them that you're interested in working with them and that you've taken time to really learn more about what they're looking for first before reaching out.
Hey, so I'm going to go over some of the questions. The first question is, are all of the concentrations STEM designated for OPT purposes? And my initial answer is, I don't know. And I actually think the answer is no, because we've been working on this for undergraduates, and unfortunately, the public health designation is not considered STEM. So I will try and get a better answer for that question, but the first answer is I don't know, and the second answer is probably not STEM designated. The second question is, can individuals with a bachelor's degree apply to the PhD program? And the answer to that is no. You have to have a master's degree completed by the time you enroll in the program, which would be, August 2024. So you would need to have that. We don't accept anyone without a master's degree.
But we do have a great MPH program. So if you're interested in coming to the School of Public Health, it's a really, if this is where you want to go for your PhD, it's great to come to the MPH program. You can work with the faculty, get involved in their research, and then go on to that path. So that is something to consider as well.
I'll get to the chat questions in a minute. The third question is, how is the program structured if a student opts for part-time? And that's really at the student's pace. Some students take 3 classes a semester, and that would be progressing pretty quickly. Others might take 1 or 2. Students have to be enrolled in at least 3 credit hours to maintain student status. But, it really depends on the flexibility of the job, of the setting that they're in, of the demands at the time. So it's quite flexible. I will say, as anyone that comes in the part-time program, they've also applied to work with someone who's doing research in the area that they want, and they're assigned a faculty advisor. So in those situations, you're still engaging with faculty, but you're not within a research lab in the first couple of years, because you're primarily doing coursework and you're not getting paid to do work activities for that faculty mentor. The last question was in the Q&A. Oh, wait, there's a couple more. Hi, a physician from Ghana. What events can international students participate in to qualify for application fee waiver? I do not believe that Georgia State waives its application fee, but I would reach out to connect with Sophus about an application fee waiver, and I will get a better answer to the question about Georgia State's application. And then there is no GRE required for the PhD program. We do not require that anymore. Okay, now there are a couple of other questions. I will maybe complete my graduation in May. If you're going to graduate in May, you could still apply and be accepted if you're pursuing a master's degree and you're going to graduate. And in the event that it would extend into fall, if you got accepted into the program, you could just defer registration for a semester. That has been a possibility. So as long as you're pursuing a master's degree and there's a good likelihood you're going to complete it next year, by May, you would be eligible to apply. And great news about the, pursuing an MPH. Those are, we also have an MPH program that we can share information about if you're interested in it. If you have another undergraduate degree, you would not be eligible to apply unless you have a master's degree. Could international students find assistance to have a tuition fee waiver? Yes. Students that are international students can get a tuition waiver if you are associated with a fellowship. So our graduate student fellowships provide a stipend, which is a monthly payment for your work, and they provide a tuition waiver. Students still have to pay fees for the program, but it's much reduced. I think there's a few other questions and answers, and then I'm going to turn it over to Dr. Gilmore. Are only full-time students eligible for fellowships? Yes. What's the average monthly stipend students receive? It's approximately, I'm trying to do the math. Go
I
ahead.
think it's $1,800. I mean, if you do, it's a yearly stipend divided throughout the year, so it's 22,000 typically.
Yeah, so the stipend is an annual amount paid over months. It's $22,000, but it could be supplemented. That's the minimum that it is. Occasionally, students will receive additional pending, certain programming, like if you were on a certain kind of fellowship. But the stipend is generally $22,000 paid over a 12-month period. And so whatever 22,000 divided by 12 is the monthly stipend. Are classes for coursework primarily in person or virtual, and do they tend to be during business hours? No, they don't tend to be during business hours. Our graduate program is set up so that every graduate course is taught once a week for 2.5 hours at a time. And that means that you would be often attending a class either in person, asynchronous online, or synchronous online. For that one class would be done in 2.5 hours. Most of our classes meet from either, late afternoon, like 12:30 to 3:30, or 4:30 to 7. And a lot of our classes are virtual. We have in-person classes, virtual classes, and we have hybrid, which is a combination of both online, asynchronous content, and in-person. I stopped at the question about international student from Nigeria. Is it required to submit the English language test? That's a question I don't have the answer to. I'm going to say no. Is there going to be an advising session for prospective MPH students? Good question. I think the answer is yes, and I will make sure to find the link for that. We are always recruiting. Our sessions for MPH students are not just fall admissions. We admit in spring and fall, so there's more opportunities for that. We're going through an admissions process right now, but I'll find a link for details about the MPH program. And then, is there a maximum length of time? It's 10 years once you start. Okay. Do you want to answer some of the questions in the chat? I'm going to find the link for the MPH program.
Yes. So yes, I'm happy to. So just looking through. So if you have a master's degree in economics or an MBA, those are both master's degrees. Yes, you are able to apply. There are some prerequisites if you don't come in with an MPH that you'll need to complete. And that's really there for a couple reasons, but you're going to want to take them just so that way you're not lost. It is really helpful. So that way you're really prepared to go into the PhD program. But you can be admitted. We have a lot of students who are admitted with a master's degree other than an MPH. Okay. How much tuition? Oh, sorry, I missed a question. Let me go back up. So do master's students qualify for graduate assistantships or research assistantships? So if you go into the MPH program, we do offer some graduate assistantships. Yes. It's not automatic, but yes, we do offer some. The next question is how much tuition waiver is offered. It is Typically with a fellowship for PhD, it's a full tuition waiver. However, as Dr. Stauber mentioned, there are student fees. Those are not included in the tuition waiver. And the student fees vary year to year. I think right now they are at $600 a semester, but you can look that up on the tuition information on Georgia State for graduate tuition. You don't have to worry about the tuition piece if you're going to be full-time, because we do mostly tuition waivers with fellowships, but pay attention to the piece about student fees. Okay. See, would you be able to speak to the specificity of research interests that you would like to see in the statement of purpose? So yeah, so for example, my research focuses on alcohol and sexual assault. I also focus on building prevention programs for underserved populations, for minoritized groups, for LGBTQ groups, and for military. So really, if in applications, I'm looking for someone who has a little bit of information about what I study, and they talk about those specific research interests. So I would want to be looking for people who are interested in studying alcohol and sexual assault, because that's what my research expertise focuses on. That's what most of my research studies are on. That's what people would be doing for their dissertation focus. So I'm really looking for someone who studies pretty similar information to what I study, or who are interested in that. Sometimes we have, people we have a big tobacco research group. So people who are interested in tobacco research, specifying what you're interested in, and then maybe what populations you're interested in looking at. And if you have looked at the faculty's interest, you might find a study that they're looking at right now and that you'd be interested in learning more about that, or it is really specific. And it is nice to put that in there, only if it's true. It's not really helpful to put in there if it's not true. And if you're not sure, that's okay. It's okay to say that I'm not sure exactly where I want to focus on. However, in looking at the faculty's research, I found these areas, and I would be interested in learning more about them. Because you don't want to it will shine through in the interview if you get to that next stage, that if that's not really what you're focused on. Yeah, Christine, do you have other thoughts on that?
I think we really see this as a program where you match with someone who has, you might not know the depth of what you really want to pursue the topic, but, being specific about the topic that you're interested in and aligning it with someone that has that expertise in our school is important. Whether or not you have to say that you want to do, structural equation modeling of a research question. You don't have to have your dissertation proposal ready, but you do need to say, I want to align with someone that's doing this work, and that that you're familiar with their work, I think is important.
Thank you. Okay, so the next question is, how many prerequisite courses should I complete? You don't have to complete any prerequisite courses. You just need a master's degree to apply and be admitted. So you don't need to worry about that until you're admitted. And then if you're admitted and you need to take some prerequisites, we would meet with you and help you through that, and look at syllabi that courses you've gone through before, and see what matches and what doesn't. And then we'll kind of get you set up. The next question is about the equivalence from the World Education Service for the US. I don't know if that qualifies.
Any master's degree is fine. Whether or not you would be, you may have to complete some courses that are required by the Council on Education for Public Health. So that would require you do some additional classes in the program, 1, 2, 3. But yeah, if you have a master's degree, it doesn't matter what kind of master's degree, or if it's from an international institution, those will qualify you to apply for the PhD program. You will want to talk about in your application, though, why, if you're from a different field, why you want to go into public health and why you're pursuing research in public health.
I'm going to switch over to the Q&A section because we're getting questions in both. So would a Master of Science in Veterinary Epidemiology and Public Health count as an MPH? It's unclear to me. It really is about CEF accreditation. If it counts for a MPH, I wouldn't worry so much about that. Just worry about if you have a master's degree, and then you're welcome to apply. What is the acceptance rate for the PhD program? I don't know that off the top of my head. Do you know, Christine?
Well, I think again, we have a lot of applications and we have fewer funding slots. So, it's going to be a balance between how many slots for funding. If everyone on the page that you see accepting faculty accepting students has a PhD slot or more, then we'd likely accept that many people. If it's 15 or 20, we would be willing to accept that many. It's usually, though, a match of like interests and the fellowship and the timing. So we don't have a proportion to report.
There's questions about the PhD in public health funding and potential supervisors. I'm not sure exactly what those questions are. If you want to specifically ask some more questions, I'd be happy to answer them. But we did give an overview of the PhD in public health and the funding, which is a fellowship, typically if you're coming full time, which includes a stipend and a tuition waiver, as well as the potential. Dr. Stauber went to the website and showed you how to find the potential faculty advisors. But please, if we didn't answer your questions, please ask them again or be a little more specific so we can answer exactly what you're asking. Are MPH students required to reach out to faculty members before application? So I think here you're talking about the MPH application. No, you're not required to, and you're not required to for PhD either. There's no requirements for that. You can just apply to the MPH program, and Dr. Stauber put the information in the chat. Do you want to put it in again, just so it's at the bottom again? Let's see. How and when is a PhD interview conducted? So we conduct interviews typically in February. You'll meet with several PhD faculty advisors, and they have been over Zoom since 2020. So I imagine they will still be that way this year. And really what we would do is reach out to you, let you know that you've been selected for an interview, and find a time that works with the faculty members that are interviewing you, as well as what works for you. What is the typical GPA of accepted students? I don't have that information on hand. I think when we review applications, we review the whole application. So if you do have a lower GPA, but let's say you have other strengths, please write that in your statement. So that way we know. We do read statements and try to be fair in our assessment because we really want strong PhD students. And sometimes things happen that dip your GPA. And if you just kind of tell us what happened and acknowledge it in a very short, succinct way, we can at least know what was going on and to understand the whole application. All right. So I got a message specifically about me and if I'm accepting students. I'm accepting students as a co-mentor, but we do have 2 faculty members who study alcohol and sexual assault, who are taking students as a primary mentor. So please, you're welcome to mention all of our names in the application. So that would be Rochelle Leone. Let me put her name in the chat. She studies alcohol and sexual assault, and so does Laura Salazar. So if you're applying and you want to research alcohol and sexual assault, then please list us all. And then where can I find the information for faculty to work with? So Dr. Stauber is going to our website right here, and I will put I will put it in the chat as well.
Our
Um,
website it does have a lot of information. So, these are the primary faculty that are accepting students in fall of 2024. And so you can see their topic areas. You can also see more about them. The other place you can go is in this spot here where, sorry, if you look under faculty, it does describe all faculty and faculty that are linked to key areas. So I will say it's not entirely perfect, but you could say, oh, I'm really interested in epidemiology. These are the faculty you might want to look at their work. Okay. But best I would say is probably focusing on the faculty that are currently accepting students, which you can find on this page here. Sorry.
Yeah, and if you go down, you can see that we have steps to apply, which is to choose a concentration and a mentor. That's the first step. So that's why we have faculty who are accepting new students linked there. But then we also have a section of areas of expertise. So if you're one of those people that aren't sure what you want to study yet, you might want to check out this areas of expertise to get a good understanding of what our research focuses on at the School of Public Health here at Georgia State, and you can really get a good understanding there. Okay, so is it mandatory to reach out to faculty before applying? No, it is not mandatory. As is on the website, there's a Q&A already up there. So if all of your questions are answered by that Q&A, could you share one of those Q&As, Christine, or do you want me to?
You said the FAQ or sorry, the Q&A.
Just for the faculty here, I'll go ahead and
Oh
share.
yeah, those Q&As. Sorry,
Yeah.
there's a lot of Q&As in my face.
So many. So if you go to can you see my screen?
Yes.
Okay. Let's say that you're interested in learning more about what Professor Arias teaches or focuses on. So there's questions in here about what projects will students be working on for their funding. If there's no funding, what would they be working on? So it really just goes into detail there. What are you looking for in a prospective student? Current students, and tell us about the positions that your former students have gone on to. So you can see really you can click on the ones that have answered those questions, and some of them have also included their lab's website. So for example, here's Shannon Self-Brown's website that really goes into detail about the team, what students, prospective students. So here's a whole set of information for prospective students. So if you have all this information for you and you don't have any additional questions, you don't need to reach out to the faculty member. They're going to be reading your application.
We've had a number of questions about waivers for the graduate school application fee. And I will say that if you go to the graduate school and there is a section about waivers, I'm going to put it in the chat. We don't have any ability to change that. That's a process at the graduate school. So if you don't qualify for one of the conditions under which they do waive the application fee, you could connect and try and reach out to the graduate school to see if there's any other situation. But the short answer is we can't change the waiver. We cannot grant any waivers.
Thanks. There's a question about, does the fact that having completed thesis, capstone, or ALE as a final project during the master's degree have any bearing? I will say it depends on the faculty member. Some faculty really look for students who have completed a research thesis because they want to see that you've gone through the research process with your own project, but not all faculty require that or are looking for that. So it is important when you're applying for a PhD program to highlight any research experience you've had. So because this is a research degree and we just want to make sure that you know a little bit about research and that you know enough to know that it's definitely what you want to do, because it is a rigorous program. So we don't want to accept people who don't really know anything about research because you may not know if you like it yet. So there is that as well. I think we may have gotten through all the questions.